The Mayor is being urged to do more to support deaf and disabled people with mental health issues. A report by the London Assembly's Health Committee says communication barriers are often misinterpreted as aggression by health professionals, with 92% of blind or partially sighted people saying there were no emotional supports being given to them when they were diagnosed with conditions like anxiety or depression. Well, let's just focus on the situation for deaf people to begin with. Dr. Sheldon is the Chief Executive for the Royal Association of Deaf People and with us now. Do you think today's report goes far enough in terms of what it's suggesting? It wants to see more done, but is enough being done here?
It's certainly a step in the right direction, but we know that deaf people live with inequalities every day of their lives. And at the Royal Association for Deaf People, we work really hard to help deaf people redress some of those inequalities. So certainly a step in the right direction. It's really comprehensive, it's really thorough, but there are things we would take forwards or suggest go forwards within that report.
Yes, some of the recommendations are things like tech services, also a pan-communication programme that the Mayor would work on to try and help people. What recommendations would you make to the Mayor and to the Assembly?
Okay, well, first and foremost, we would talk about services being delivered in a deaf person's first language, which is really important. That doesn't happen often enough, so the report could really push that home a little bit further. Preventative services hardly gets a mention within the report. Services such as information, advice and guidance, if we get those to deaf people when they need them, that will often reduce feelings of isolation and loneliness and even depression maybe, which could then help to redress some of the issues around mental health challenges which deaf people may face. So, you know, let's get preventative services in there in somebody's first language, first and foremost. One of the big things that we struggle with at the Royal Association for Deaf People is the, I hesitate to say it, but slightly ad hoc commissioning practices across London. So, for example, you may have a deaf person living in one street, and in the street 2 rows down the mile, sort of 2 lines down the road, for example, you might find that a deaf person is receiving vastly different services, which is just not acceptable. So if we could actually join up commissioning across London, that would be extremely helpful. And the last thing that we would suggest is thinking about GPs, and GPs are the gateway to mental health services, but often GPs aren't deaf aware. They may struggle in terms of helping deaf people book appointments, accessible services, and also I would question how many GPs actually book interpreters. So the report's great, and we really do welcome it, but actually there is more that could be done.
Yeah, a step in the right direction. I imagine from what you've said, some of the experiences that the people that you speak to and work with are along those lines, that they might go to a GP and feel incredibly frustrated because the GP, there's no communication there, there's not the ability for them to communicate.
You're absolutely right. What we often hear is that when deaf people go to the GP, it's actually really hard to receive information in an accessible format. Interpreters aren't booked, for example, and deaf people really struggle, and a lot of the time they won't go, which means that they suffer even more in terms of day-to-day health or mental health as well. What we also find is things like helplines, for example. Somebody might say, well, call the helpline. Well, actually, that's not possible for a deaf person. So if I'm phoning a helpline, for example, then it would be because I want an instant response. What deaf people are being told is, drop us an email, which isn't acceptable at all. And similarly, GPs are quite reluctant to fund specialist deaf services. So, you know, deaf counsellors, they are there and they're great, but they're just not used enough.
Okay, good to get your thoughts on this. That's Dr. Sheldon, the Chief Executive of the Royal Association for Deaf People. Thank you for joining us this lunchtime. We will